Hello, good afternoon, everybody who's watching me right now and everybody who will be watching me later on. I'm Dr. Manshu on behalf of Jaipur Rehab. I welcome all of you for the most awaited and one of my own favorite sessions of the day, Biomechanics of the Gait. Gait is such a wonderful thing to be studied, it's such a wonderful topic to be discussed, and at the same time, such a beautiful thing to be analyzed during your clinical practice. So this is what you need to know and how much clinically implicated the gait is. So that is what we'll be trying to learn today. And before that, I'll be telling it to you about various, parameters on which the gate has to describe. So we will be having a joyride, trust me. But before that, I must tell you one small thing that yes, we have successfully completed the first module of the biomechanics that included our biomechanics of the hip joint, biomechanics of the knee joint, and the biomechanics of ankle and foot. So by that, I must tell you one small thing that we had given you some tests. We had given you some quizzes for that related to the topics we have covered in the last sessions. So I request everybody of you who are listening to me, please perform that test. Please get noted by yourself that how much you have learned, because we have to make a country, we have to make a physiotherapeutic fraternity in India who's at the level of the, or in fact, much better from the students who are working in the Western countries or any other countries in the world. So we have to make you have to make yourself, and we all have to make a nation which has physiotherapists of at par quality. Okay, so we have to enhance the quality of the physiotherapist. All right. So no more motivations. I'll be getting on to my topic of the day. That will be your biomechanics of the gait. There I come, and I can see there is such a beautiful, we can say, man running on the left side of my screen. So that's too good. And let us start by introducing myself. I'm Dr. Himanshu Mathur. I'm working as an assistant professor in the Department of Physiotherapy, Jaipur National University, and also I'm working as a chief physiotherapist for my physiotherapy clinics, and I'm also working as a chief physiotherapist and director for Jaipur Rehab. So let us start the joyride. So first of all, the most basic question that a person can ask you: what do you mean by gait? Gait is a rhythmic pattern. भाई gait होता क्या है? Gait है pattern of walking साधारण भाषा. चल रहा हूँ मैं. If I am walking, if it is a normal pattern or a normal pattern, any pattern be it. If it is any pattern, I am walking in any whatsoever pattern, that is gait. Okay, if I am trying to analyze various variables of the gait, various variables of the pattern of my walking, that is what is gait. Okay, and gait is a performance of a thing which is propulsive in nature, which is propelling us forward. So series of rhythmical alternating movements of the trunk and limbs which result in forward progression of the center of gravity. Okay, so what am I doing actually is, it is a rhythmical movement of my upper limbs and my lower limbs and my trunk such that I can propulse or progress my center of gravity forward. Okay, so this is what is meant by gait. Now we can directly come on to the terminologies of the gait without losing any more time. So we have temporal variables and we have spatial variables. Temporal variables also always have things related to your time. Okay, all those variables which could be quantified on the basis of time, they would be included in the temporal variables, and the spatial variables, they are usually considered on the basis of distance. मैं कितना distance चला, एक मेरे स्टेप की क्या लेंथ थी, मेरा स्ट्राइड की मतलब एक पूरे कंप्लीट गेट साइकिल की क्या लेंथ थी, दैट कम्स इन दी स्पेशल वेरिएबल्स. मैंने चलने के लिए कितना टाइम लिया, एक गेट साइकिल कंप्लीट होने के लिए कितना टाइम ले रहा हूँ, एक मिनट में मैं कितने स्टेप्स ले रहा हूँ. सो दे आर ऑल टेम्पोरल वेरिएबल्स और टाइम रिलेटेड वेरिएबल्स, राइट? So that is what we have to see here is the first temporal variable that we'll be talking about is the single limb support time. Single limb support means the phase when I am standing only on my one leg. The other leg is in the air. जब मेरा एक पैर जमीन पर टिका हुआ है और वो ही गवर्न कर रहा है, वो ही बेयर कर रहा है सारा वेट, और दूसरा जो वेट है, दूसरा जो पैर है मेरा, इट इज इन द एयर, दैट इज कॉल्ड सिंगल लिम्ब सपोर्ट टाइम. ओके, दैट इज कॉल्ड सिंगल लिम्ब सपोर्ट रादर. और वो फेज पूरी गेट साइकिल का, जब एट एनी पॉइंट ऑफ टाइम मेरे दोनों पैर कांटेक्ट में है ग्राउंड के, दैट विल बी कॉल्ड डबल सपोर्ट फेज. ओके, व्हेन बोथ माय लेग्स आर इन contact with the ground, that is called double support phase time, or double support phase system. Cadence is the number of steps taken in 1 minute, and speed, you know that at what speed I'm walking, right? So single limb support time is that the time for which I am standing on my single leg, such that you can see it here. Okay, it is the only limb which is in stance. That means it is the only limb which is bearing weight. The other one is in the air, right? So this is the only limb which is in contact with the ground. The time for which this one leg stays in contact with the ground in the whole gait cycle is known as single limb support time. Okay, and when the time for which both the legs stays in contact with the ground, it is called double limb support time. Okay, this one is the double limb support. We'll be talking about that. What are the consequences whenever both the limbs come in contact with the ground? What are the consequences when only one limb comes in contact with the ground? I told you cadence, that is number of steps per unit time. The normal value is about 100 to 115 steps per minute. Okay, it can have social, cultural, and gender biased variations also. It can have racial variations also. So there can be n number of factors which could be responsible for this. Okay, now speed or velocity, that is the distance covered per unit time, at how much distance I am able to cover in 1 minute. So usually it is 80 meters. If you can see here at the bottom, 80 meters per minute is what distance I can cover in 1 minute during a normal walking. Okay. So the next comes is the distance variable or the spatial variable, where I consider the distances, that how much distance I am able to cover in a particular given time, or these are just the distances covered in one gait cycle. Okay. So first one is the stride length. Stride length is whenever I perform one heel strike and then I perform the heel strike of that same limb. मान लो अगर I started my gait cycle from the right heel strike, okay, then one of my gait cycle completed, half of my gait cycle completed when I had left heel strike. Then I again came back for the right heel strike. So the distance between the right heel strike and the second right heel strike is known as stride length. Okay, so the distance between this heel strike and again this heel strike. Okay, this is again right foot, again right foot. So this distance is known as the your stride length, and the distance between this heel strike and this heel strike is usually known as step length. Okay, this is the length of, this is the distance covered in one step. Okay, and this is the distance covered during the whole stride, that how long stride I'm taking. Okay, या फिर how long I am taking to complete one gait cycle, how much distance I'm covering in one gait cycle. Okay, that is your stride length. Fine. Step length, I told you that left step length and the right step length they have given. So it is the distance between right heel strike and left heel strike. Okay, so the distance between the two different feet which are covering, which are placing at the same phase in the gait cycle. So you can cover the distance. You can identify the step length over here. Right? Now this is called the degree of toe out. Always remember that whenever you perform a heel strike, at the time of heel strike, the foot is not placed that straight vertically. It is placed at certain angle. Okay, there has to be some angle of the toe which is directing outwards. Okay, that particular angle is known as the angle of toe out. Usually it is 7 degrees. More than 7 degrees can be considered to be abnormal, and less than 7 degrees also, or less than 5 degrees I would say also can also be considered to be as abnormal. Okay, this is how you can calculate. That is what I was talking about. So the angle that the midline of the foot at the heel strike makes with the normal vertical. Okay, so this particular angle is known as angle of toe out and is usually 7 degrees. Normal angle is 7 degrees. Okay, so you can see here also the line of progression is straight, and the deviation from the line of progression is usually taken as the angle of toe out. We also call it as fixed angle or fixed angle. Okay, this angle is also known as fixed angle. Fine. There can be various pathologies associated with. Okay, for case with excessive femoral anteversion, you can have a in-toeing gait where the toe angle reduces even beyond zero. It could go. Okay, such that the toe could point inside, or it could be pointing across the line like this. Okay, so it could be there. The things like this could be there. And in cases of patient with severe low back pain or severe spasm in piriformis muscle also. So at the time of heel strike with the extended knee, the whole leg acts as one unit. So in that case, with an excessive external rotation of hip or the external rotation of femur, in that case, you can have an exaggerated toe out angle. Okay, so you can have this angulation say to 15 degrees also. So in that case also it is abnormal, and the case of in-toeing also it is abnormal. Okay, so this gives you a very good insight clinically when you perform a gait analysis on clinical basis, right? Moving forward, this one is my favorite slide to be considered. So these are the swing phase and the stance phase. We all know that the gait cycle is divided into two phases. One is the stance phase, the other one is swing phase. The stance phase is the phase whenever the limb is in contact with the ground, and swing phase is a phase when the limb is off the ground. Okay, when the limb is not in the contact with the ground. Okay, so in that case, we have to see that these two phases are divided into various sub phases of them. The stance phase usually starts with heel strike, then it follows with the foot flat when the whole foot comes in contact with the ground, but there is no weight bearing still. Then the weight comes over the foot, it's called the mid stance. Then further we propulse the body forward such that the heel come off the ground, it's called heel off phase. Then we propulse the whole body off again and forward with the whole foot coming into the swing, or whole foot getting off the ground. We call it as the last phase, we call it as the toe off phase. Okay. Similarly, we have three phases in swing. Whenever we just after the toe off till we reach a limited height of the swing limb, it is called the initial swing. When we reach the limited height after which the swing limb starts descending back again, it's called mid swing. And the phase just prior to the heel strike, when we are preparing the leg or foot for the heel strike, it is called late swing. Okay, or a pre-stance phase. Fine. So these are the basic phases in which we have to distinguish, or we have to divide the various phases of the gait cycle. Now, there are certain percentages written, if you can see it here, if it is visible to you. For me, these percentages are very, very, very important, and I want you people also to learn about it. So for first 0 to 5%, I would say that. And moreover, I'll be taking it as 5% rather than 0. There will be heel strike on the stance limb. At 5%, there will be heel strike at stance limb. From 10 to 15 degrees, 15%, or in some cases it could be 20% also, there would be flat foot. Okay, at this point there is heel strike. From 10 to nearly 20% of the gait cycle, there will be foot flat position. Okay, from 30 to 35% of the gait cycle, it will be mid stance position. Okay, it will be a mid stance position. At nearly 50% of the gait cycle, till the 50% of the gait cycle, you have toe off. Okay, and at almost 60% of the gait cycle, you'll be having heel off here. I'm sorry, heel off here, and at almost 60% of the gait cycle, you'll be having toe off. Okay, coming on to the other phase, the pre-swing phase is the 73%, in which we having a pre-swing phase. At nearly 87% of the gait cycle, you will be having mid-swing phase. and at nearly 100% you'll be back again after the late swing. After the late swing, at the 100% of the gait cycle, the person will again start with the heel strike. But as I told you, the heel strike starts from 0 to 5 degrees. That is why I'm taking at the 100% of the gait cycle also, I'll be taking late swing. This is how the gait cycle is usually being divided. If you want to write this out, you can write it, or you can also take a screenshot or snapshot of this screen so that you remember it later on also, whenever you see this. All right, or there will be always, this video will always be present here, so you can see it at any time. Now, the very important part that I wanted to tell you is the displacement of the COM. COM is nothing but your COG. And we all know by now that the normal position of COG is 2.5 centimeters anterior to the second sacral vertebra when I'm in standing position, right? This is the normal position of the center of gravity or center of mass. Fine. Now, I told you that there can be displacement of the center of mass both in sagittal plane also and in horizontal plane also, right? Because my mass is, because I am not doing, see, if I would have been a kangaroo and if I would have been doing a solitary movement on both the limbs, then I just had my COM or COG to be moving in a sagittal plane like this. There wouldn't have been any, what you can say, lateral transitions of it. But I have unipedal stance also, or unipedal walking also. So that is why there is a time when the whole weight is directed towards the right side. There is another time when the whole weight is directed towards the left side, right? That is why your center of gravity also moves on the right and left. So there is a sinusoidal pattern which is going on in the horizontal plane also, and there is a sinusoidal pattern where your this COM or COG is moving in the sagittal plane also, right? So it can move like this also, it can move like this also. Fine, it cannot move like this, right? So it has no frontal plane implications, but it has implications in sagittal plane also and in the horizontal plane also. Correct. Now coming on to the topic, what I wanted to tell you, do listen it very, very, very carefully, because this would change the way of your thinking, and this could give you a wonderful insight that how to treat patients while they are coming to you, be it of a paresis condition, be it of a low back condition, any musculoskeletal neurological condition, that this will give you a wonderful insight about it. Okay, so stay tuned and keep listening to it. Now, the first thing that is suggested is superimposed on the forward displacement, however, are two sinusoidal patterns of the movement that corresponds to the movement of center of mass in the vertical and medial lateral direction. That is what I told you. Now, minimum height of the COM occurs at the midpoint of both the periods. See, whenever I'm standing normally, so it is at the probably the highest, lowest point where it can go. Okay, it can go up to the normal standing position, but it cannot go down. All right, in the sagittal plane, your COM can move up, but it cannot go down from the normal standing position, because my knees are not getting bent, I'm not getting down. Okay, that is why the normal position will be the normal standing position. The COM would move like this and this and this, but the normal standing position will be the baseline. It won't go beyond it. Okay, so the minimum height of the COM occurs at the midpoint of both the periods in the double limb support. See, whenever both the legs are in contact with the ground, it means both are bearing some amount of weight. If both are bearing some amount of weight, there is no height achieved by my body. If there is no height achieved by my body, which usually is there in the single limb support, because if it is a single limb support, my body, the height of my body needs to be increased such that the other part of my body doesn't fall down. Okay, so that is why when I have both the feet in contact with the ground, this is the condition when the baseline is achieved. This is the lowest height of the COG or the COM. Okay, and when I am in single limb support, such that in a mid stance position, when there is only one leg which is bearing the weight, my COG is at the highest point. Okay, तो जब मेरे दोनों पांव टिके होते हैं जमीन पे, तो मेरी COG सबसे निचली पोजीशन पे होती है, सबसे बेसलाइन पोजीशन पे होती है, और वही जब अगर मेरा पाँव एक पाँव पे ही मैं अपना पूरा वजन दे करके खड़ा हूं और दूसरा पाँव हवा में है, तब मेरा सीओजी हाईएस्ट पॉइंट पे होता है, ठीक है। Now minimum height of the COM occurs at the midpoint of both the periods of the double limb support, right? At 5% also and 55% of the gait cycle. आप याद रखिएगा ये वो दो पार्ट्स हैं जहां पे डबल लिम्ब सपोर्ट फेज हमको मिलता है, यानी कि 5% ऑफ द गेट साइकिल पे भी हमको मिलता है और 55%। मैं वापस आप लोगों को पीछे ले जाना चाहूंगा। सी हियर एट द 5% ऑफ द गेट साइकिल यहाँ का भी टो भी कॉन्टैक्ट में है और हील इज ऑल्सो इन कॉन्टैक्ट, राइट। कमिंग ऑन टू दिस समवेयर दिस साइड, यहाँ का भी टो कॉन्टैक्ट में है एंड हील इज ऑल्सो इन कॉन्टैक्ट। सो 50 to 55% इज ऑल्सो बी कंसिडर्ड टू बी एज double limb support phase, right? So the maximum height of the COM is at the midpoint of the both periods of the single limb support, that is 30% and the 80%. Okay, now the vertical displacement of the COM is approximately 5 centimeter and the medial lateral displacement is almost 2 centimeters, right? So if my COM is rising up, it would rise till 5 centimeters. If this is the baseline, so my COM will rise till 5 centimeter only. And if this is the baseline, my COM would go laterally to 2 centimeter and medial this side also. Both laterally they'll go to 2 centimeters only. Okay. Side to side movement of the COM is also occurs during the ambulation, creating a single sinusoidal pattern, right? The maximum position of the COM to the right side occurs at the midpoint of the stance phase on the right lower extremity. That is the 30%. That is the mid stance phase. Okay, that is the mid stance phase. Always remember that. And maximum position of the COM to the left side occurs on the left mid stance. Okay, that occurs at the 80%. Okay, that is why we have given you two values, 30% and 80%. So this is the right mid stance. Okay, if we start from the right side, and this is the left mid stance. Okay, so total medial lateral displacement is approximately 4 centimeters that occurs during normal ambulation. Sorry, I told you 2 centimeters. It's nearly 4 centimeters that occurs. Right. Immediately after the right heel contact, the COM or the COG starts moving forward and upward. Now, always keep what I'll be telling you. Please listen it very carefully. As soon as I started with my heel contact or heel strike, the COM would go forward and upward. It will start, supposingly, consider this is my mask and this is your COG. Okay, suppose this is your COG. Okay, now this will start. I performed my heel strike. As soon as performed my heel strike, it started to move this superior and forward. ऊपर भी गया और आगे भी गया. अब जैसे ये ऊपर भी गया आगे भी गया, कैसे इसने वेव बनाई, ये ऊपर भी जा रहा है और आगे भी जा रहा है, राइट. This is my COG, so it is moving like this. Okay, this is moving like this, forward and upward towards the right foot. Now this is the sagittal plane, and if I see it on the transverse plane, it is moving towards the right side because the right is my stance limb, so it is going on to the right side. Okay. Now this continues for first 30% of the gait cycle, where the body is trying to climb and shift its mass. और 30% पे क्या आता है? 30% पे आता है आपका mid stance. Okay, so it will continue till it reach its peak at 30%. 30% is the peak. That is in mid stance. Okay, after the mid stance, it started to decline. Starts to decline. Now it gets declined towards the left side. Similarly, here also the peak is reached at the 30% of the gait cycle. After reaching 30%, it starts declining towards the left side. Okay, and at 80%, it reaches the peak here on the left side. Right? Similar things happen. This is how it makes a graph like this, sinusoidal graph like this, and a sinusoidal graph like this. Okay, moving forward, at the right mid stance, the COM reaches its highest position and the most lateral position also towards the right. I told you here. So in sagittal plane also at 30%, it is reaching the highest position. Sagittal plane में भी अगर मैं देख रहा हूँ तो ऊपर भी ये highest position आ रही है, और अगर मैं right side में देख रहा हूँ, medial lateral displacement देख रहा हूँ, तो भी 30% पे ये सबसे ज्यादा laterally shift हो रहा है, ठीक है ना, जो कि 4 सेंटीमीटर तक का है. Okay. Just after दी राइट मिड स्टैंस। अब क्या हुआ, जैसे ही मिड स्टैंस खत्म हुआ तो मिड स्टैंस के बाद मैंने वेट प्रोपल्स करना शुरू किया। तो जैसे ही मेरा टो ऑफ हुआ, मेरा टो ऑफ होते ही राइट साइड में, तो लेफ्ट साइड में हील स्ट्राइक होने लगा। तो जैसे ही हील स्ट्राइक हुआ तो मेरा डबल सपोर्ट फेज आ गया। डबल सपोर्ट फेज आते ही वो नीचे आने लग गया। तो हमने देखा था कि जब जब डबल सपोर्ट फेज होता है तब तब जो मेरा सीओएम होता है इट रीचेस टू द मिनिमम लेवल, यानी कि जो बेस लाइन है वापस वहां पे वो आ जाता है। ठीक है ना। तो जब ये मेरा यहां से मिड स्टैंड से क्रॉस किया, हील ऑफ गया, तो हील ऑफ जाते ही लेफ्ट साइड का हील स्ट्राइक हुआ। लेफ्ट साइड का हील स्ट्राइक होते ही मेरा वेट कहां शिफ्ट होने लगा, लेफ्ट साइड पे। तो वो जैसे ही लेफ्ट साइड पे शिफ्ट होने लगा, मेरा ग्राफ भी शिफ्ट हो गया लेफ्ट साइड। ठीक है ना। लेफ्ट साइड पे कैसे शिफ्ट होगा, हॉरिजॉन्टल प्लेन में जो मैं ग्राफ बना रहा था, तो वो साइनसॉइडल वेव जो थी वो लेफ्ट साइड में शिफ्ट होने लगी, राइट। एंड इट स्टार्टेड टू फॉल डाउन until I reach the left side mid stance। जब तक मेरा लेफ्ट साइड का मिड स्टांस नहीं आया, ये मेरा नीचे गिरता गया। और जैसे ही मेरा लेफ्ट साइड का मिड स्टांस आया, या पहले तो जैसे ही मेरा हील स्ट्राइक आया, सबसे नीचे चले गया, बेस लाइन पे आ गया। फिर जैसे ही मैंने लेफ्ट साइड पे फुट फ्लैट हुआ, ये थोड़ा सा ऊपर चढ़ा, और जैसे ही मिड स्टांस की तरफ में बढ़ता गया, ये बिल्कुल ऊपर चढ़ गया। बिल्कुल ऊपर चढ़ के जैसे ही मैं मिड स्टांस पे आया और लेफ्ट साइड के सिंगल लिम्ब सपोर्ट पे आया, ये जो मेरा ग्राफ था वो हाईएस्ट पहुंच गया लेफ्ट साइड में। ठीक है ना। ये सबसे ऊपर था, सेजाइटल प्लेन में भी ऊपर था सबसे 5 सेंटीमीटर। और अगर मैंने इसको देखा ट्रांसवर्स प्लेन में ऊपर से देखने की कोशिश की, तो लेफ्ट साइड में इसने अपनी मैक्सिमम पीक अटेन कर ली थी। कहां पे, लेफ्ट साइड में ऑफ 4 सेंटीमीटर, राइट। अगर इतना आप समझ गए हैं तो आई थिंक यू विल बी इजीली एबल टू अंडरस्टैंड एवरीथिंग, राइट। इफ यू हैव एनी क्वेश्चंस यू कैन राइट इट इन द कमेंट बॉक्स। ओके, now this initiates heel contact on the contralateral limb also, so as to prevent fall of the body on the other side। अगर मैं, क्योंकि मेरा वेट लेफ्ट साइड में शिफ्ट हो रहा है, तो अगर मैं हील स्ट्राइक नहीं करूंगा तो गिर जाऊंगा लेफ्ट साइड में, इसीलिए हील स्ट्राइक हुआ, यहाँ से टो ऑफ हो गया, तो एक डबल लिम्ब सपोर्ट फेज आया मेरे पास। एक वो समय जब दोनों राइट एंड लेफ्ट एक्सट्रीमिटीज जो थी मेरी, दे आर इन कॉन्टैक्ट विद द ग्राउंड। ओके, सो यही वो रीजन था कि जिसकी वजह से मेरा सीओजी था वो बिल्कुल बेस लाइन पे नीचे आ गया। ठीक है ना। पहले सिंगल लिम्ब सपोर्ट में तो ऊपर उठा हुआ था, तो जैसे ही बेस लाइन पे आए वो एकदम से नीचे आ गया। ओके, नाउ जस्ट आफ्टर द लेफ्ट heel contact during the double limb support phase, the COM is located midway between the feet and reaches its lowest position। हमने बात कर ली है। and it continues to move forward and towards the lower extremity। अब क्या होगा, जैसे ही हील स्ट्राइक के बाद फुट फ्लैट हुआ लेफ्ट साइड में, तो ये लेफ्ट साइड में घूम गया और ऊपर चढ़ने लगा और आगे बढ़ने लगा। और जैसे ही लेफ्ट साइड का मिड स्टांस आया, ये टॉप पे पहुंच गया। अब वो कौन सा परसेंटेज ऑफ गेट साइकिल था, दैट वाज 80% ऑफ द गेट साइकिल, राइट। दैट वाज 80% ऑफ द गेट साइकिल, जब लेफ्ट साइड में मिड स्टांस था और मेरा सीओजी जो था वो लेफ्ट साइड में जाके टॉप पोजीशन पे पहुंच गया। ठीक है। तो मेरा जो ग्राफ है वो पहले चला ऐसे, इधर से आकर के, फिर सांप की तरह से इधर से उठा, फिर इस तरफ गया, एंड देन फिर इस तरफ से गया। आई होप मैं आप लोगों को एक 3D मॉडल दिखा पाता है यहाँ पे, बट 3D मॉडल मैंने कोशिश की है इन दी नेक्स्ट कमिंग स्लाइड्स कि मैं आप लोगों को दिखाने की कोशिश करूँ, राइट। सून आफ्टर द लेफ्ट मिड स्टांस, अच्छा जैसे ही लेफ्ट में मिड स्टांस पे टॉप पे था, लेकिन जैसे ही हील ऑफ हुआ वहां पे वापस नीचे गिरने लगा। और जैसे ही हील ऑफ के बाद दूसरी तरफ राइट साइड का हील स्ट्राइक हुआ, तो वो वापस 0 पे आ गया, बेस लाइन पे आ गया। ठीक है ना। और हमारी गेट साइकिल खत्म हो गई। ठीक है ना। सो दिस वाज द थिंग व्हाट आई वांटेड टू टेल यू। अब just try to look at this video. At the center you'll be having a center of mass here. I hope that you'll be able to see this video. Now this is the area देख रहे हो आप, ये this is the center of mass, and this is the sinusoidal pattern in the sagittal plane that it is showing, right? So this particular phase, see this now, this is the center of mass, okay, and this is moving in a sinusoidal pattern. So as soon as there is a double limb support, this is coming down. As a single limb support, you are having the highest peaks. This peak is achieved at 80 and 30 and 30, okay, whenever you have single limb support, okay. And this is the baseline situation at the double limb support, okay. So always remember that. You can just have a look of it. Probably there will be a superior view also of it. Okay, there is no superior. Fine. Now, this is what I was talking about. This is the baseline in the normal standing position, right? It is a normal standing position, or it is achieved in the double support phase also. Okay. And this is achieved at 30% of the gait cycle and 80% of the gait cycle. Okay. This is the translation, vertical translation of say 5 centimeters. And similarly, this could be the this is again the peaks achieved at the 30% and 80% of the gait cycle, and this is the mediolateral transformation, mediolateral translation in the left and the right side. Right? Now, very easy to be performed, very easy to be understood. The kinetic energies and the potential energies, because it is an activity, there is a certain work done, and we require energy to perform a certain work done, right? So in that case, we should know the considerations, that how much is the energy being conserved, or how much is the energy being utilized in particular, or consumed in performing a particular task. Now we'll be talking about the kinetic energies and potential energy. We all know that kinetic energy is a form of energy that is required when the body is in motion, and potential energy is the form of energy which is required when the body is at rest. Okay, so when the body is at motion, so the formula is half mv square. Okay, we all know that for kinetic energy it is half mv square. Okay, so when a body is in double limb support phase, then the velocity of body is more, because there is a unanimous and optimal weight distribution on both the limbs. So there will be more speed when my both limbs will be in contact with the ground. जब मेरे दोनों पैर जमीन के कांटेक्ट में होंगे, तो मेरी वेलोसिटी हमेशा ज्यादा होगी. वेलोसिटी ज्यादा होगी तो हमेशा मेरी काइनेटिक एनर्जी उस समय ज्यादा होगी. वही जब I am in single limb support phase, my velocity will be low. If my velocity will be low, my kinetic energy will also be low, very much low. Okay, so always remember, my kinetic energy is very low at 30 and 80% of the gait cycle, because I am into mid stance. Okay, that is why it is written that minimum kinetic energy is reached at mid stance, 30% and 80% of the gait cycle, and maximum kinetic energy is reached at the double limb support, that is 5% and 55% of the gait cycle when there is a double limb support phase, so which eventually increases the mobility and speed. अच्छा, अब उल्टा हो जाएगा कि काइनेटिक एनर्जी मोशन के समय ज्यादा होती है, पोटेंशियल एनर्जी स्टैटिक के समय ज्यादा होती है, व्हेन द बॉडी स्टैटिक. तो इसका मतलब बिल्कुल उल्टा हो जाएगा. जब सिंगल लिम्ब सपोर्ट में मेरी बॉडी की वेलोसिटी कम है, तो उसकी पोटेंशियल एनर्जी ज्यादा होगी, और जब मूवमेंट है डबल लिम्ब सपोर्ट फेज में, जब मूवमेंट ज्यादा है, वेलोसिटी ज्यादा है, तो हमेशा उसकी पोटेंशियल एनर्जी कम होगी. अच्छा, इसका फॉर्मूला क्या है? mgh. ठीक है ना. इसमें h stands for height, because mass is the weight of the body, g is acceleration due to gravity. These are constant in case of any human body, because I cannot change the mass of the body, I cannot change the acceleration due to gravity. What I can change is the height. Okay, height of the COM or the COG. और अभी अभी हमने देखा था कि जब भी डबल लिम्ब सपोर्ट फेज होता है, तो हाइट ऑफ द COG इज वेरी लो. ओके, तो COG को बराबर बीच में रखने के लिए जो एनर्जी कंज्यूम होती है, दैट इज कंसीडरेशन ऑफ द काइनेटिक एंड द पोटेंशियल एनर्जी. ओके, सो व्हेनेवर during the double limb support phase, the height is low, the potential energy is also very low. That is at the 5% and 55%, the potential energy is very low. But whenever the height is more, especially in the cases of mid stance, or at 5% and at the 80%, sorry, at 30% and at the 80%. So when you are into mid stance, and when the height of the COG is too much, in that case, always remember that you'll always have greater potential energy. Okay, this is what is written here. Okay, now let us see the considerations of the potential energy. So in the green, blue, you have potential energy. In the orange, you have the kinetic energy, right? At the starting, in the 5% of the gait cycle, you have double limb support phase. So you have more velocity. So you have greater kinetic energy, and at the same time in the double limb support phase, you have very low potential energy. At 30%, whenever you have greater single limb support phase, you'll be having greater potential energy, and lesser kinetic energy. Fine. Again, at the 55% of the gait cycle, you have double limb support phase. So you have low potential energy and high kinetic energy. Right. Again, at the 80% of the gait cycle, you are again into the mid stance on the opposite limb. So you always have low kinetic energy and high potential energy. All right. Very easy to be understood and easy to remember as well. Okay. Coming on to this sagittal plane kinematics, I want you people to see this video, but we'll be coming back to it again. Whenever जब भी हम लोग पूरे एक एक segment देखेंगे, तो हम लोग वापस आएंगे. Just see to this video. I'll not be explaining it right now. I'll be explaining it when I'll be telling you things about it. Perfect. Now the completion of gait cycle is there. This is the late swing जहाँ पे खत्म कर दिया है. Okay. This is the sagittal plane view. Now, talking about the first segment of the lower limb, जहां से हम sagittal plane analysis कर रहे हैं, always remember at the 5% of the gait cycle, यानी कि heel strike है, heel strike पे double limb support phase होता है, तो there will always be a posterior pelvic tilt. Okay, याद रखना at 5% यानी कि heel strike पे there will always be a posterior pelvic tilt. जैसे ही मैंने पाँव रखा तो मेरी pelvis जो थी it went on posteriorly. Okay, it tilted posteriorly. Then मैं उससे foot flat में गया तो after 10% in the gait cycle, pelvis starts to move in anteriorly. And at 30% of the gait cycle, that is mid stance or the single limb support phase, there is a significant anterior tilt in the pelvis. तो जब मैंने heel strike किया तो पूरा posterior था, फिर धीरे 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 करके 10% पे वो आगे आई और 30% पे वो completely anterior tilt. Okay. Now just after 30% in the gait cycle, pelvis again goes posteriorly till toe off. Toe off के बाद वो posteriorly चलेगी. Okay. Now 60 to 87%, that is in the initial or the mid swing, then again the pelvis comes anteriorly. And at terminal swing, whenever the limb is preparing to get into heel strike, it went back to posterior. तो सबसे पहले posterior tilt, फिर एंटीरियर, फिर पोस्टीरियर, फिर एंटीरियर, फिर पोस्टीरियर. ठीक है ना. तो ये चीज वापस से एक बार देखना जब मैं आप लोगों को ये बताऊं. This posterior, it is coming anterior, going posterior, coming anterior, anterior, and posterior on that side again. See, there is a significant posterior tilt. You can see that, right? Because it is preparing for the heel strike now. Whenever it is preparing for heel strike, there is a significant posterior tilt in the pelvis. And whenever it is coming for the mid stance, see, it is coming and see it has started coming anterior. And whenever it was the left side, okay, now see it in the left side, it is coming anterior. Okay. So whenever you are into mid stance or whenever you cross the heel strike position, it starts coming to anterior tilt, and after the mid stance, when it goes towards the toe off, it goes to posterior tilt, and in the swing also, in the late swings also, it has posterior tilt. Fine. So always remember that particular thing. Coming on to the hip joint, so at the heel contact, the hip joint is flexed, say to 30 degrees. There is a very slight 30-degree flexion at the heel contact, because the foot, the leg, the whole leg has to progress. It is a propulsion, okay, propulsion of the body. अगर hip का flexion नहीं होगा तो पाँव आगे बढ़ेगा कैसे? ठीक है ना? So you have 30 degrees of hip flexion coming here. Now after the mid stance, the hip starts to extend and reaches a maximum of 10 degrees of extension just prior to the toe off. Okay. जैसे ही मिड स्टांस में क्रॉस किया, हिप जो था वो एक्सटेंड करने लगा. ठीक है. बिकॉज नाउ द अदर पार्ट ऑफ द बॉडी इज कमिंग फॉरवर्ड बट नॉट माय स्टैंड स्लिम. तो जैसे ही मेरा स्टैंड स्लिम वहीं पे है लेकिन बाकी बॉडी आगे प्रोग्रेस कर रही है, तो मेरे स्टैंड स्लिम में हमेशा एक्सटेंशन होगा एंड इट कंटिन्यूज टिल जस्ट बिफोर द टो ऑफ. ओके. देख लेते हैं फटाफट ये दोनों छोटी छोटी चीजें. ठीक है. At the heel strike, just see at the heel strike, it is into flexion, and after the mid stance, it is going into extension. You can see that, right? You can see this here. Okay, it is going into extension just after the mid stance. Okay, Now till toe off, the hip starts to flex and reaches neutral, and more flexion is initiated during pre-swing. Okay, you have to do more flexion during pre-swing because you have to lift the whole leg up in the air. Okay, so that जो आपका foot है वो clear कर जाए, it clears the ground, so it successfully get off the ground. तो इसलिए आपको हिप का फ्लेक्शन चाहिए, आपकी पूरी एक्सट्रीमिटी फ्लेक्स होनी बहुत जरूरी है उसमें, ठीक है ना, ड्यूरिंग द प्री स्विंग फेज. Now then the hip undergoes more flexion during swing phase to bring the lower extremity forward and the next foot for the placement. Okay, और भी मैंने फ्लेक्शन किया स्विंग फेज के दौरान, so that I can do it on the swinging leg को I can take more forward by flexing it and to prepare for the coming heel strike. Okay, again the maximum flexion is achieved during the heel contact जहाँ से हमने शुरू किया. All right, now coming on to the knee joint. At the normal condition, at the heel contact, the knee is flexed to 5 degrees. There is a 5 degree of knee flexion is there. At 15% of the gait cycle, the knee is flexed to 10 to 15 degree and is controlled by the eccentric contraction of the quadriceps. Okay, because you are moving onto it, because you are putting weight onto the flexed knee. That is a point where the quadriceps contract eccentrically. It allows you to go into the movement by its lengthening contraction. Okay, so always remember, at 5 degree of heel strikes, say 5% of the gait cycle, the knee is flexed to somewhat 5 degrees. Okay, and at 15% of the gait cycle, the knee is flexed to somewhere 10 to 15 degrees. All right, then the knee extends fully till the heel off, and at 40% of the gait cycle, knee flexes again to say 35 degrees till the toe off. So it is the point where you have done your heel off and you are preparing to go for the toe off. So between the heel off and toe off also, you have your knee to be flexed till 35 degrees. Okay, you have your knee to be flexed till 35 degrees. Now the knee goes into flexion in the initial swing also, such that the toe, the foot, the whole foot clears the ground. ओके आपको पूरे फुट को क्लियर कर लेना है ग्राउंड पे, इसलिए हमारी जो नी है इट गोज इनटू फ्लेक्शन. देन द नी कम्स बैक अगेन इनटू एक्सटेंशन to prepare for the next heel strike, right? So this is a very easier thing. Always remember this particular value, that at the time of the heel strike your knee is flexed to 5 degrees. Then eventually slowly थोड़ा सा बढ़ता है and आपके 15% तक 10 to 15 डिग्रीज तक हो जाता है, ठीक है ना. फिर उसके बाद नी पूरा एक्सटेंडेड रहता है 40 डिग्री तक. मतलब whenever you are in your mid stance also your knee is completely extended. लेकिन जैसे मिड स्टैंड से क्रॉस करते हो एंड वेट शिफ्ट शुरू होता है, आपका नी भी फ्लेक्स होना स्टार्ट हो जाता है, ठीक है ना. नाउ कमिंग ऑन टू द एंकल जॉइंट. At the heel strike, the ankle plantar flexes to 0 to 5 degrees. Usually what people think is that the ankle is in a dorsiflexion. No, the ankle is rather at neutral, or it can be slightly in a plantar flexion. Okay, it is not in dorsiflexion. Now in first 8% of the gait cycle, the foot flat is achieved by plantar flexion of the ankle joint. We all have studied it very well in our last presentation or last classes of the ankle and foot, right? So it is an open chain, what you can say, plantar flexion of the ankle joint till the foot flat. Then there is a closed chain dorsiflexion. Okay, from the 8% to 40%, then the 10-degree dorsiflexion occurs at the ankle joint in the closed chain. We have already discussed it, where the tibia is moving anteriorly. Okay, now at the 40% of the gait cycle, that means it has crossed the mid stance and moving towards the toe off. Okay, or the heel off, for between the heel off and toe off. So at 40% of the gait cycle, the ankle starts to go into plantar flexion, which reaches to 15 to 20 degrees. Just a second. That's some huge. Okay, so ankle dorsal, what I was about was after the heel strike, after the heel off and toe off, there is usually 15 to 20 degrees of plantar flexion, which is achieved. You can easily identify when there will be heel off. If there is heel off, I am already standing in an equinus position. If I'm into an equinus position, there is a significant plantar flexion at the ankle joint, right? So this is something which is needed to be undermined, or which is needed to be considered. Okay, ankle goes into dorsiflexion in the swing phase, such that there can be efficient clearing of the foot from the ground. Okay, now foot, the first MTP is slightly hyperextended at the heel strike. It is very slightly hyperextended. From heel strike to heel off, the first MTP is neutral, but at the time of heel off, the first MTP joint goes into extension. Okay, from heel off to just prior to the toe off, the MTP goes into hyperextension of say 45 to 55 degrees. Okay, so there is a significant hyperextension from the heel off to just prior to the toe off. क्योंकि जैसे toe off होगा तो वापस hyperextension से neutral पे आ जाएगी. Okay, लेकिन heel off जैसे होगा, heel off is usually accompanied by hyperextension of the first MTP joint. Okay, now during the late part of the stance phase and initial swing, the first MTP joint flexes to come to the neutral position, right? So this is a very easier thing that you need to consider here. Coming on to the frontal plane kinematics, now I'm looking at the patient from the front. So always remember that whenever you are clinically examining the gait of any patient, always look for all of these parameters that we have discussed it right now. Okay, when you are looking the patient from laterally, when you are looking the patient from front, or whenever you are looking the patient from superior plane, or whenever you are having a transverse plane analysis of that particular patient. All right. So whenever I'm looking from the front or from the back into the frontal plane, the pelvis and hip, let us consider what happens to the pelvis and hip. From 15 to 20 degrees of the gait cycle, it means it has crossed the heel strike and it is going towards the flat foot situation. Okay, probably it is into a flat foot condition. So in a flat foot phase of the gait cycle, the pelvis drops on the swing side. Okay, pelvis drops on the swing side because now it is preparing the stance limb for the single limb support. क्योंकि जैसे जैसे मैं फुट फ्लैट से मिड स्विंग की तरफ जा रहा हूँ, मेरी दूसरी तरफ वाला पांव हवा में उठने वाला है. हवा में उठने वाला है तो वेट बेयरिंग स्टार्ट करेगा मेरा स्टांस वाला लिम्ब, और जैसे ही मेरा स्टांस वाला लिम्ब वेट बेयरिंग स्टार्ट करेगा तो मेरी कॉन्ट्रालेटरल साइड की जो पेल्विस है वो ड्रॉप होना शुरू हो जाएगी. तो मान के चलो, सपोज दिस इज माय पेल्विस एंड दिस इज माय स्टांस लिम्ब. ओके, इफ दिस इज लाइक इट, तो अगर जैसे ही मैंने पांव आगे बढ़ाया तो कॉन्ट्रालेटरल साइड वाली पेल्विस जो है वो ड्रॉप कर जाएगी. तो जैसे ही मेरी कॉन्ट्रालेटरल साइड की पेल्विस ड्रॉप करती है तो मेरी स्टांस साइड का जो हिप है, इट विल एक्सपीरियंस अ क्लोज चेन अडक्शन. ओके, इट विल हैव अ क्लोज चेन अडक्शन. सही बात है ना. अगर एसिटाबुलम इज मूविंग टुवर्ड्स द फीमर और माय पेल्विस इज मूविंग टुवर्ड्स द फीमर, इट इज अडक्शन. ओके, एंड इट इज मूविंग, व्हेन इट इज मूविंग अवे फ्रॉम द फीमर, इट इज कॉल्ड abduction. Okay, so whenever this stance foot is preparing for the weight bearing, initially the contralateral side of the pelvis drops down. Okay, it drops down, causing some amount of adduction on the stance side. Now whenever after the 20 degrees, जैसे ही मैं इस पे वेट बेयर करने को आया, वेट बेयर करने को आते ही मेरी स्टांस साइड की ग्लूटियस मीडियस ने वर्क किया and it pulled the contralateral pelvis up. Okay, such that there was a significant hiking of the pelvis on the contralateral side, causing abduction on the stance leg. Okay, so जैसे ही मेरी ग्लूटियस मीडियस ने वर्क किया, ग्लूटियस मीडियस ने वर्क करते दूसरी तरफ की पेल्विस को हाइक कर दिया, ऊपर खींच लिया, और एंगल बिटवीन द पेल्विस एंड फीमर इंक्रीज्ड, causing some amount of abduction in the stance leg. Okay, now the knee joint. Usually the knee joint is stable in the frontal plane. Usually कोई खास valgus varus abduction बहुत ज़्यादा नहीं होता है. Very small amount of abduction sort of things are being visualized or visible. Okay, in stance phase at a speed of 1.2 meters per second, 1.2 degrees of abduction or valgus is present at the heel strike. Heel strike पे ऐसा होता है, but थोड़ा बहुत हमारा physiological valgus भी होता है. There is always some amount of physiological valgus which is present at the knee joint because of the larger medial condyle. All right. So in that case, there is a very small amount, that is 1.2 degrees of abduction, is visible or is measurable at the time of heel strike. Now in swing phase, 5 degrees of abduction is present in initial swing. So there is some amount of increased abduction present at the knee joint in the initial swing when my foot is getting off the ground. All right. And the maximum abduction occurs when the knee joint is near full flexion. All right. Coming on to the frontal plane analysis of the ankle joint, ankle and foot. So at the heel strike, there is almost 2 to 3 degrees of inversion. This also we have talked about in very detail when we were talking about the ankle and foot. If you have any problems, you can again refer to the ankle and foot video so that you can get a proper orientation or proper insight about this. Okay. Anyways, we'll be taking it again. So at the time of heel strike, I told you whenever you perform heel strike, the whole foot is in supination, and the component of supination is inversion. So that is what is written in the first point, that whenever you perform heel strike, there's 2 to 3 degrees of inversion that occurs. Now from heel strike to mid stance, as soon as I am starting to bear weight on my stance limb, from inversion it goes into eversion. Okay. So from supinated position, it goes into pronated position. All right. And there is a significant eversion present at the subtalar joint. There is a subtalar eversion leading to pronation of the foot. Now, maximum pronation is achieved in the mid stance position. All those people who are following me in the ankle and foot, they must be knowing about this position, right? So a maximum pronated position is achieved in the case of mid stance position. This is the time when the subtalar joint, okay, it is a time when I am bearing a complete weight. So whenever my stance limb in the single limb support is bearing full weight, my foot is in pronation. And as soon as I start propelling my weight forward, so I'm passing with the mid stance, my weight is getting transferred onto the other limb. My pronation gets converted again into supination. That is, my subtalar eversion again shift or reverses into subtalar inversion. Okay. So after 30% or 35% of the gait cycle, when I pass the mid stance, my calcaneum again tries to come into inversion from eversion. Okay. So the foot starts to begin with the supination. Now reversing the direction of motion at the 40 to 45%, the heel off is achieved, and the calcaneum reaches its normal or the neutral position. Now, between the heel off and toe off, 6 degrees of calcaneal eversion occurs. Okay, so there is some amount of increased supination from the heel off and toe off also, and the foot stays to be in supination during the swing phase also, and some amount of swing is increased while the foot is planning to get into the heel strike again at the stance phase. Okay. Coming on to probably the last phase of the kinematics and last phase of the today's talk or the today's class, that is the horizontal plane kinematics. I hope I am able to convey what I want to convey to you, right? That is why I've tried to make my language very simpler and very easily comprehensible to everybody. If you have any questions, you can write down directly into the comment box. I'll be there to see that. Okay. Now, talking about the horizontal plane kinematics, that is, I am looking onto the whole lower extremity from superior aspect, right? So whenever I see about the pelvis, so at the heel strike position, the ASIS of the stance leg moves forward. Okay, so if I am talking about the heel strike of the right side, suppose this is the right side and this is the left side, and right side is the stance side. So at the heel strike, my ASIS will go a little forward. Okay. And for first 15 to 20% of the gait cycle, there will be counterclockwise rotation of the pelvis. So the pelvis stays to move in this direction. That is, the ASIS of the right side will stay to go forward, will move anteriorly only. Okay. Now for the rest of the stance phase, the pelvis moves clockwise. That means whenever I have passed the heel strike and my foot flat position, my right side ASIS comes back to posterior, come back to backward position. Okay, the whole pelvic complex starts to rotate counterclockwise. Okay, it starts to rotate counterclockwise like this. Okay, Now for the rest of the pelvis of the stance phase, the pelvis moves clockwise, where the contralateral ASIS moves forward. When my ipsilateral ASIS is going backward, the contralateral will be moving forward along with the progressing swing limb. Okay, because that swing limb have to go for propulsion of the body forward, right? That is why the contralateral ASIS will be moving forward. Now the pelvis moves 3 to 4 degrees each direction. The whole translation of this clockwise and anti-clockwise, the total movement will be 3 to 4 degrees only, right? Now coming on to the femur, after the heel strike, the femur rotates internally. Usually at the heel strike, either the femur can be straight or it can be into slightly external rotation, right? But after the heel strike is done, the femur starts rotating internally. Okay, at the heel strike it was like this, and after the heel strike it started rotating internally. It went on to the internal rotation for first 15 to 20% of the gait cycle. Now at 20% of the gait cycle, that is at the foot flat phase, the femur rotates its directions and start moving externally till the toe. Now after the foot flat, whenever I am moving on to the mid stance till the toe off situation, till the end of the stance phase, it will continue to move externally, continue to rotate externally. Okay. Now femur rotates to almost 6 to 7 degrees in each direction. Tibia also moves in the same pattern as the femoris do. All right. So this is again a very easier thing that we needed to talk about. Coming on to the hip joint as in total, the hip joint initially at the heel strike, it goes into slightly external rotation. Then the maximal hip rotation for almost most of the time of the during the stance phase will be external only, because from the heel strike to the foot flat only it moves internally. For rest of the whole motion, it is going on to be rotating externally. All right. Coming on to that of the knee joint. At the heel strike, the knee is in 2 to 3 degrees of external rotation, along with that of the femur, along with that of the hip joint, because the hip joint is also going into external rotation. So because it is into complete extension, that is why nearly complete extension, that is why the femur and hip acts as one unit. So if femur is going into external rotation, the whole knee joint would also go into somewhat of external rotation, and that too 2 to 3 degrees more as compared to the femoral rotation. Okay. Now throughout the stance, the knee continues to rotate internally by the action of tibia. So usually by the rest of the stance phase, the tibia would go internally. Tibia would rotate internally. But during the toe off, the knee achieves 5 degrees of internal rotation. Okay, so there is a significant 5 degrees of internal rotation which is being achieved by the tibia at the time of the toe off. And during the swing, the knee joint rotates externally back again. Okay, because it has to prepare the knee joint for the heel strike. That is what we know, that at the heel strike we have 2 to 3 degrees of external rotation. Okay, so probably we don't have anything after this, and the house is completely open for questions. If you want to ask me any question, you are free to ask. Yeah, you can write it in the comment box. I can see that. If you have any questions, you can write it in the comment box. I can see that right here. Any questions if you have? I'll be waiting for the questions. If you have any questions, you can definitely look onto it. Okay, सबसे पहले तो ये बताओ समझ में आया? Because we have tried to take 3-4 different domains here today in today's talk, today's session. So if you didn't understood that, please do contact me by anyhow. If you have your questions, you can mail it to me. You can write it on any of my social media. I'll be there to answer it every time. Okay, I'll be answering it to you, be it your WhatsApp, be it your Facebook, be it Instagram, be it your Telegram, anything, anywhere. If you can just encounter, or if you just write your queries, I'll be there to answer. That must be related to the topic. And I request everybody, yeah, there are a few questions. Initially in 30% of these stance, yes. At the 30% of stance, it is a single limb stance, and I told you that whenever you are into single limb stance, your COG will be at the highest point in the frontal plane also, in the striatal plane also, and in the mediolateral deviations also. So the COG will go at 5 centimeters superior and 4 centimeters on the mediolateral. Okay. Yeah. We have another question coming here. Uh, can you explain? Yeah, can you please repeat the displacement of COM in short? Yes, we can do that. So what happens is, okay, whenever uh, there is a whenever I start with the gait cycle at the heel strike, okay. So always remember two things whenever you are talking about the displacement of the COM. That whenever you are in double support phase, whenever both the what you can say things are both the legs or both the your what you can say feet are in contact with the ground, your COM is at the lowest position. It is at the baseline. Whenever you are in single limb phase, the COM will be at its highest position. Okay, on in the sagittal plane also and in the transverse plane also mediolaterally. Fine. So whenever you are into mid stance, okay, at 30% of the gait cycle and 80% of the gait cycle. On 30% of the gait cycle, there is right-sided mid stance, and on 80% of gait cycle, there is left-sided mid stance. So your graph or your COG will be at 5 centimeters height in from the sagittal plane also, and in the horizontal plane also there will be lateral deviation on the right side on the 30% of the gait cycle, and on the left side on the 80% of the gait cycle, right? And on the 55% cycle, when you have double support phase, there will be the minimum position, lowest position, and onto the baseline. Okay, from here also it will come out in the horizontal plane also it will come to the baseline, and on the sagittal plane also it will come to the baseline. I think that must be clear to you in short. Okay, there's another question. What I read was maximum abduction occurs at the loading response. Where? And when knee is in swing phase, it is in adduction. It is in adduction. No, there could be hip joint external rotation with hip joint slide adduction. I can take that. That is what we studied, that whenever there is a pelvic drop, there can be an, what do you say, assistive sort of thing, adduction on the stance side. And whenever the work of gluteus medius occurs and the limb is pulled up, there can be adduction on the other side in the swinging, right? Kinematics nahi aaya pura. Kinematics, Nikhil will take it whenever I'll be taking your class also. Okay, so I'll take it at that time. Okay, there is another question. Can you please repeat the muscle work in frontal plane? Muscle work मैंने लिया ही नहीं आज. Muscle work I'll be taking it tomorrow. Okay, muscle work I'll be taking it tomorrow. Maximum abduction is in the swing phase. That is what I told you. This abduction is relative with the relative position of the pelvis. So whenever the pelvis goes in drop, there could be adduction, close in adduction on the stance side. And whenever there is an action of gluteus medius and the pelvis is hiked on the other side, there could be abduction on the stance side. But similarly, there will be abduction on the other side, right? So you have to go according to that. Yeah, another question. How we remember all these changes occurs in gait? That is what you have to keep walking, keep analyzing, and that's how you can go for it. See, if you'll try and go read different books, you'll find various different things there, right? So that is too clumsy to read it from book. That is why I've taken out very small and easier points such that you can note down also, and you can keep memorizing it at times. That what is the angle, what should be the angle. So if you'll go and see various patients and try and analyzing various patients out of it, so that'll become quite easier for you, say after 1 year or 1.5 years, to just visualize and say that particular pathology is existing in a gait or not. Okay, that is why I'm telling this to you, that you should know, because everybody does not have the nomenclature based pathological gaits, right? So that is what is the implication. These are what the impairments that you need to take out. It is not always that you can give a name to a particular gate. Every gate doesn't have a name. So try to take out impairments based on these parameters. Okay, we have another question. Sir, how was knee joint in external rotation at the heel strike? Knee joint is external rotation by the virtue of external rotation at the femur also, and because of the toe out angle also the tibia goes into external rotation, say 2 to 3 degrees of extra external rotation. All right. So because of that also, and whenever I'll be taking muscle work tomorrow, these questions will be more clear to you. Okay, it is by the action of the muscles also. Okay, there are cases of low back pain where piriformis is usually tied. Piriformis is the potential external rotator of the hip joint, right? So whenever I'm doing heel strike, by the action of the tight or spasmodic piriformis, the hip joint or the femur might be going into more external rotation, right? So it can lead to more external rotation at the knee joint also, and an increased toe out angle also, that is the fixed angle. All right, so that will be more clear tomorrow when I'll be taking your class onto the muscle work, when I'll be talking about the forces and vectors coming onto the different, and the torques especially. We'll be talking about the torques tomorrow, and probably if all of these things happen tomorrow, we'll be closing the chapter tomorrow. Right? So stay tuned, stay with me tomorrow. We'll be there at 12 sharp tomorrow noon for the rest of the part of the biomechanics of Gait. Thank you so much. Stay tuned here. We'll be taking more questions tomorrow. Thank you so much. Bye bye. Stay home and